Ashley with Amare. So, I don't know what's been in the air this week, but you guys are mad at your surgeons. Oh boy. All right, so let's talk about this. This is difficult for you guys because I know when you go to like a regular doctor, you go there and they check you out or whatever, and they tell you to schedule a follow-up with them, right? Okay, so if you have a really good doctor, or if your doctor's like a personal friend or something, they'll maybe call and check in on you or something, right? So I don't know why you guys think your doctors are so hands-on. They're not. Guys, your doctor is just a surgeon. That is it. So when you go to Miami, after you get like cut and you get your surgery done, they're like, okay, bye. They wheel you out. You're done. The recovery house picks you up or whoever picks you up and you're out and that's it. You usually don't even get a follow-up. And that's what Miami is for, right? They're just for the surgery. They do the surgery. You guys go there and that's it. You get cut, you get your surgery done, and that's it. There is no aftercare. Even at some of the recovery houses, yeah, they'll feed you, but most of the times it's got salt in it, which isn't good for you. Yeah, they'll pick up your meds sometimes. Yeah, they'll wash your faja and stuff like that for you sometimes. And that's a good recovery house. But they're not going to teach you how to wear your faja. They're not going to tell you what to do. They're not going to look at your incisions professionally. So going back to my original point, you guys expect your doctors to be like super hands-on. That is never going to happen, guys. Stop blaming your surgeons. Aftercare, which is everything after surgery, is your responsibility. I cannot express this enough, guys. I get so upset for you guys because you're so lost. You had surgery, even with a doctor in New Jersey, even with a really good doctor, right? Even with a doctor who's, in your state, and there, you'll have a week follow-up, you'll have a 2-week, 3-week, 1 month, 3 month, 6 month follow-up, whatever it is. And the most common thing is you go in, you're all swollen, and they're like, oh, you look fine. And you're like, what? No, I don't. Like, I'm super swollen. I don't look fine. And they're like, no, you look fine. Like, you're great. You look great. Or maybe, so best case scenario, you get your surgery. Your doctor beforehand tells you about lymphatic drainage, or you ask because you've done your research. They tell you, yes, go ahead, start whenever you want, go get it done. They give you a faja. That sometimes is okay. Honestly, I have never seen a surgeon, that's not true. I have seen some surgeons that give really good fajas, but they are not meant to do that, guys. They're just surgeons. They just do the surgery. So even a good doctor, they tell you to do lymphatic drainage. They tell you to stay away from salt. They give you whatever, nutritional things that you need. The patient care coordinator checks in on you the next day. Make sure that you're okay. If you need to get your drains out, or they check your incisions, or all those things. But guys, that's as far as it goes. And that's on a good case scenario. Like 90% of doctors don't really even tell you about lymph drainage because that's your responsibility to find out about. Everything aftercare, your faja, your foams, you taking care of your incisions, taking care of your drain. Now, drains are a little different. Your doctors usually have to take them out. That's a little more hands-on. But all of the things encompassing that, your diet, how much water you're drinking, what you should be doing as far as lymphatic massage, when you should start, all of those things are your responsibility, guys. You have to do the research. You can't get mad at your surgeons for this. That's not their job. They are just surgeons. The end. Now, I understand this can be a very, very, very emotional procedure. I understand it can be a very emotional journey, which is why we exist. We are a full-service plastic surgery recovery center. We teach you what true manual lymphatic drainage is. We measure you and fit you for your faja. We're post-op certified fitters. We make sure you have the right faja. We give you your supplies as far as proper strength arnica. Guys, arnica gel. I have a whole video on this. It's not strong enough, and you're probably not even using it right. Wearing your faja properly, how to get it on and off without having to struggle and squeeze yourself into it. What a proper faja is. How to sit on your BBL pillow. How to sleep. How to lay down. How to drive. How to go to work. How to live after surgery. That's what we do. Full service recovery center. It's everything. It's not just we're going to give you lymphatic massage and that's it. So that's what we're here for. We are here for the 24/7 support. That is the point. Throughout your whole sessions, throughout all of it, you have the therapist in the room that you can ask questions with. You have your virtual consults with me that you can set up. You've got your pre-op and your post-op session with me where I give you everything you could possibly need to know about your surgery specific to you. But guys, stop blaming your doctors. They are the surgeons. They did whatever they needed to do for you. They looked at you, they told you what you needed, they did the surgery, they did the cuts, they did whatever, and your surgery came out perfect. Everything after that is up to you. I have another video talking about botched, why people think they're botched. 90% of that 99% of that is bad aftercare. Fibrosis, hardness, dented BBLs, all the crazy scary things, seromas, all the crazy scary things. That's the aftercare that happens that goes wrong. Or you just didn't have any aftercare to begin with. And that is a huge problem. Cannot express to you guys this enough. Your doctor did their job. You could pay, so you can go to Miami and get a $5,000 lipo job done, or you can go to New York and get a $12,000 lipo job done. They're going to treat you the same. The same. The reason you're picking your surgeons, and I also have a video on that, the reason you're picking your surgeon is because of the results, the technique, the skill, and the way they do the surgery. Everything else is your responsibility. You guys have to find good support afterwards. And if you don't have good support, you call us, you come to us, we set up virtual consults, we do whatever we need to for you so that we make sure you're on the right track. But stop blaming your surgeons. They did their job and they did it impeccably. And I tell this to you guys all the time when you come in the room and you look at me like I have 5 heads, and I'll look at you and I'll say, your surgery went great. You look perfect. Everything's symmetrical. Everything's perfect. And you're like, oh my God, I'm swollen. I'm bruised. I have hard patches. This is not perfect. This is not what I signed up for. It's a month out and I'm still in pain. My incisions don't look right. What is going on? It's because you didn't have any aftercare. You didn't take care of it. And I understand. I fully understand. You guys, this is not cheap stuff. This is super expensive stuff. These surgeries can be really expensive and exhausting. There's time off of work. There's people that you need to get to help you. There's a lot that goes into having surgery and planning for it. And I totally understand why you'd be upset. Because should your doctor tell you to go do this stuff? Kind of, yeah. Should your doctor inform you, like, hey, you should go get lymphatic massage? Yeah. Should they tell you, like, hey, you should really find a place that's gonna, teach you all these things? Yeah. But that's not in their training. Their training is literally to just do their job. And their job, doctors, nurses, patient coordinators, everyone in the office, is just to do the surgery. Make sure you're safe. Make sure it goes well. Make sure that everything as far as the surgery standpoint heals properly and that everything is good. But all the aftercare is your job. Do not blame your doctor for not informing you. This is why there are a million surgery pages. This is why I do these videos. This is why we exist. It is our job, it is my job to make sure that you are on the right path and the right track and have everything that you need to for your post-op protocol to make sure that you're getting things done properly and you're taking the right steps and you're not messing up your BBL and that you're informed. That is the biggest thing, guys. If you're thinking about surgery, if you've had surgery, even if you picked a doctor and you're scheduled for surgery or you just had it done, you still need to be informed. People ask me, how late is it? That's usually the big question, like, oh, am I too late? No, I've had people come to me 5 years later with fibrosis all over their stomach, with a BBL that they're not happy with a tummy tuck that the scar is all kinds of crazy, and they're still swollen. Guys, the swelling is not going anywhere. Aspiration, where they stick the needle in you and suck fluid out, that's not going to help with your swelling. Drainage massage, where they rake through you and blood comes out, that's not going to help with the swelling or the fibrosis. That stuff you have to actually take care of and seek out a trained post-op professional. You have to actually do your research. You have to do a deep dive and take control of this because your doctor is not responsible for that. Your doctor is responsible for you up to the point of surgery, even after surgery a little bit with your follow-ups to make sure you're healed. But everything after that is on you. Your diet, your sleeping, your garments, your foams, your recovery is your responsibility. So let's go over the list of things doctors don't tell you that you need to be informed about. Your diet post-surgery. You need to make sure that you are drinking enough water and not having salt. That varies for everyone. It varies for every surgery, but that's like the golden rule. So that's number 1. Number 2, your lymphatic massages. You need to be getting those. How do you know where to go? How do you know what true lymphatic drainage is? Watch the rest of my videos. But you do have to get those. A lot of doctors will tell you, oh, it's not required. Oh, they don't work. Oh, that's not a real thing. But if you're still swollen 2, 3, 4, 5, 6 weeks out, yeah, you should probably be coming in, guys, and you should probably be getting those done. Because like I said, fluid's not going anywhere, which is a good thing, but bad thing, it's not going anywhere. So you have to be getting those done. And then your garment and foams, your supplies. You need to make sure you have a proper fitting garment. If it is too tight, it will cause fibrosis and more swelling. If it's too loose, you will never heal properly. If you don't have proper foams, if you're using boards, if you're using all kinds of crazy shit, you're not going to heal right. If you don't have a proper BBL pillow, you will also not heal right. There are lots of things that goes into the supplies, proper arnica, wound care, stitch and incision care, tons of stuff that you need to be aware of. So all of those things are things that you should be looking into, as well as talking to other people who have got it done, seeing what they've done. Come watch our videos. Read our stuff online, read our website, look at our material. We have all the information out here to educate you guys on what you need before, during, and after surgery. But you have to be informed and stop doubting your doctors. Stop yelling at them. Stop being mad at them, because all surgeons all around the world will do the same thing. Again, guys, they are just there for the surgery. Now, as you're doing your research, you can ask them, hey, what about lymphatic massage? Hey, what about this place? Hey, should I be eating anything or avoiding anything? All those different things. Now, diet is a little bit different for everyone because some people have health conditions, some people need to have salt. There are lots of things that go into that, which is why we talk about that in our post-op and pre-op sessions. But all of those things you have to think about. And then, of course, surgery per surgery, there are tons of other things you're not thinking about. Like, if I had a tummy tuck, how am I supposed to get around? When can I go back to work? When can I start exercising? Lifestyle-specific things for your surgery and for your body. We cover all of those in your session, in your pre-op and your post-op with me. So there are always information and things like that that you're not going to remember or not even going to be able to think about to ask your doctor because, one, you're nervous or you're excited or you're scared. Two, you're on all of these drugs after surgery, and doctors love when you're still high off anesthesia to talk to you and tell you things. So there's things like that where you're not going to know what happened. I often ask you guys, okay, so how many liters did they take out? And you're like, what? And I'm like, okay, did they lipo your back? And you're like, I don't know. And I'm like, because it looks like they did. And you're like, yeah, I think I remember him saying while he was in there he did my flanks, but I don't know. And I'm like, you should probably ask because that's kind of useful information that you should know about your body as to where you had your surgery done. So there are a lot of things that your doctor is responsible for, but your recovery and aftercare and everything post-op is not their job. That's why we're a plastic surgery recovery center, and you have to be informed. You have to be informed. Also about lymphatic massage, you have to be informed. Do not book a post-op with us and get mad and get angry because we're not cutting you open and we're not using deep pressure and we're not using oil and we're only using our hands. You do not get mad at us for that because that is, again, you being informed. There are enough videos on this Instagram. There are enough videos on our website. There is enough material and information that tells you exactly what kind of lymphatic massage that we do. Again, guys, be informed. Now, if you've come back from Miami and you want to get aspiration done because you feel like you still have stuff in there that you want to do, there are places in New Jersey that will do that. Now, keep in mind, if they are not a nurse or a doctor, sticking you with a needle is illegal in New Jersey. So there's that. But please be informed. Please read our material. Please watch our videos. If you have questions, please call us because our girls will spend extensive time on the phone with you explaining the exact technique, the exact hands-on, everything that you need to know about your sessions, what it's going to be like, and help you get booked and help you get scheduled and talk to you about all these things. We are huge on educating you guys and making sure that you're getting the proper care that you need from wherever you need it, even if it's not us. We will give you references and things like that. So please be informed. And again, guys, your doctor is not evil. He did not mess you up, or she did not mess you up. It is not their job to do the aftercare for you. It is your job to seek out that information. And yes, maybe they should tell you, but again, that's not their job. It is not their requirement to look after you after surgery. Please, guys, do your research. This is something that everybody gets super upset about. I cannot express it enough. I know it's super frustrating because trust me, it would be easier if they just sent us, your info and sent you our info right off the bat and said, hey, go get your stuff done. But again, do your research. Do your research on your doctor. Do your research on your aftercare. Seek out the information and be informed before all of this happens, and then you have fibrosis and you're freaking out and don't know what to do, and then you're angry at your doctor. It is not your doctor's fault. Your surgery went fine. Your surgery went perfect, unless there was something that didn't go fine and perfect. Then that's a different story. But all of this is your responsibility, and you have to take charge with this stuff beforehand. So that is the end of my spiel. Like I said, you can always call our office for information, for scheduling and things like that. And this is exactly why that you get a post-op with me before you purchase any packages ever at all. You schedule a post-op with me, or you do your first session with one of our girls if you don't want a post-op and you just want the massage. Because again, you need to be informed about what this is and what's going on. So I definitely encourage you guys, again, watch our videos, read the material on our website, call us if you need information, and I will talk to you guys soon. I hope this was helpful and not just a rant about how you guys should stop being mad at your doctors. Have a good rest of your day, guys. I will see you all very soon. Thank you for watching. Bye.